So naloxone is available in most countries of the world in ambulances, sometimes in hospitals, sometimes you can buy it with a prescription in pharmacies, and it's usually used for people who have got heroin or other opiate overdose, right? We also see that if drug users have naloxone, they can easily, successfully and safely inject it to someone else who is experiencing overdose, and that prevents death.
In Scotland, we seem to have a particularly significant problem. Across Europe, drugs-related deaths had declined, but unfortunately in the UK that's not been the case. And indeed, Scotland has a higher prevalence of drugs-related deaths than anywhere else in Europe. And this graph here shows the significance of the problem. We have 55,000 opiate users, but we lose, on average, 550 per year now. It's increased by 131%. Really substantial problem, but naloxone is nothing but a pure opioid antagonist. It's not addictive, you can't abuse it, a very, very safe drug. It's really only indicated for one thing, which is respiratory depression and nothing else. Naloxone is nothing new, it's been around since 1915, and as you can see there is ample evidence of the efficacy of this substance. One of the challenges we have in Scotland is our current drug strategy. It's called the Road to Recovery. And as was mentioned earlier, this idea that we have to aim to support people to get off drugs means that there's a bit of a conflict when you are supplying naloxone, because sometimes people think that means you are enabling drug use or making heroin use safer, which we are, but not by any manner of means to encourage use, simply so that people don't die. The thing that we campaign for is naloxone over the counter. Why is it that I can go into any pharmacy and buy paracetamol, which is far more toxic to my body than naloxone could ever be? Why is that? We also need it normalised and standardised, if you like. It should be, in our view, the case that anyone receiving opiate substitution or using illicit opiates is afforded naloxone. It should just be part of the work that we do. Indeed, the overdose prevention stuff should be part of the work that we do as harm reductionists. We are trying to flood our streets with as much information about naloxone, about overdose as possible. 545 families were bereaved last year. And I'm going to quote Sars Maxwell: "His actions speak louder than words, and giving opiate users naloxone demonstrates to them that it matters whether they live or die. There's no hope of recovery if you're dead." And that's one of the key statements, if you like, that we are trying to convey all across Scotland.
It is a drug that has saved my friends' lives, and also people I've worked with at Needle Exchange have used it 4 times and watched people who were close to death and unresponsive and turning blue come back and be able to talk to me later that day and the next day, and are now still alive today.
So I can testify that naloxone is safe and effective in arms of drug users. And we think that not only in our region but in other regions there are enough people who have got the same experience in their life. So what we propose that together with you, your partners, your clients, your organizations, doctors, the friendly doctors, all together we collect this evidence, analyze it, and send it to decision-making bodies.